Assalamu alaikum, I'm Dr. Tahira and you're watching program Health is Wealth on PTV World. Who do we love more than ourselves? Of course, our children. We're always worried about their health and we want the best for them. That is why today we will have a detailed discussion about child health, children's diseases and how we should manage them with Dr. Junaid Jahangir, child specialist. Welcome to another episode of Health is Wealth. Today we will be discussing all about children's health. Why are children always absent from school? What is it that's bothering them? And how do we take care of their health in detail? That is why we have with us child specialist Junaid Jahangir. Dr. Junaid, how are you? Thank you so much for joining us, Dr. Junaid.
Most welcome and thank you to you for inviting me to the show.
It's a beautiful clinic you have out here and I'm sure that children also enjoy coming here with their parents because they get well and leave from here. Why is it that children are most susceptible to fevers and flus, especially in this season? Because winter is around the corner, hopefully it will be, and there's a lot of pollutants in the air as well. There's a lot of smog, there are a lot of viruses. So what are the most common viruses that you're facing lately?
Well, children are always prone to develop infections because they have a low immunity. The younger the child, the more is the chance of getting infection. We have a lot of pollutants here in Pakistan, and we have a lot of pollen here in Islamabad, and besides this, viruses are always common around the year. Especially this is the winter is the favorite season of the flu viruses, the adenovirus, the rhinovirus, and all the viruses which can cause throat infection, chest infection. Pneumonia is very common as the winter is coming, so we will be expecting a huge number of children with pneumonia.
So how do we actually prevent children from getting sick? You said we have to improve their immunity. Should we keep them warm? Should the room be ventilated? How do we improve their immunity? What do we give them or do we vaccinate them?
Okay. Well, immunity starts from mother feed. First of all, they should be given mother feed. Then they should be given natural diets, not junk foods. Then they should be properly immunized. Then they should be prevented. If somebody gets an infection in the home or in the daycare or in the school, then that child should be segregated.
Okay. And what about this, like for example, if a child develops flu, they start coughing and sneezing and have fever, and what most people nowadays do is they follow the web and they start antibiotics on their own. So can you please tell them, and especially our audience out there, that they should not self-medicate, they need to go to a pediatrician, get evaluated and then take the medicine?
Well, we always discourage this practice and we don't recommend taking medication, especially antibiotics, without a doctor's consent. And especially in the younger children, because often the mother only sees cough.
Right.
She says that my child is having cough, but underlying he may be having pneumonia, he may be having tuberculosis, he may be having asthma. So all of these conditions, they present with cough. So only parents can't know what is the exact cause of coughing. I often tell my patients, always find out the cause, what is actually wrong with your child. If you are able to find out what is actually wrong with your child, then he or she don't need so many antibiotics.
Exactly. So what is the flu vaccine? Does it help children? Do you advise that all our viewers out there should get their child vaccinated against flu?
Yes, I personally vaccinate myself, my kids, and I recommend the flu shot to all of my patients. Around 50% protection is there. I will not say that if you give this vaccine, you will not have any fever or cold or throat infection or flu, but what I have personally witnessed that you will be protected 50%. You will reduce 50% visits to the doctor if you do this vaccination.
Okay, when we talk about flu, there is always fever associated with it. So how much fever in a child is normal? And if a child starts really getting very high continuous fever, how do you go about it? When do you start doing cold sponging? Do you alternate between acetaminophen and ibuprofen? What is the ideal method of fever control?
Well, it's a big myth that when the child is having fever, the mothers and the grandmothers, they start giving him sweaters, jackets and quilts. I always say that whenever a child has fever and it crosses more than 100 Fahrenheit, then you need to undress the child and you need to do cold sponging, and only tap water is enough. There is no need of putting cold water. The normal tap water is enough. And besides this, every mother should have paracetamol suspension at home. That is the first thing which they can do by their own. But on the contrary, what we see that when we receive children having high fevers, sometimes they present with fits due to high fever, and they have a lot of sweaters and jackets, and the mother and the father both are anxious, and they don't, and in that tension, they even forget to give the child paracetamol.
Oh. So it is very, very important that the fever be brought down. That is what you're saying. And should they give a shower? And when they do cold sponging, should they place it on the forehead, in the underarms, groin, or feet, or tummy? Where should they be placing it?
Well, the best place is to place at the forehead and on the chest.
Okay.
As far as the underarms is concerned, what we have personally witnessed, they take alcohol swabs and they put in the underarms. That will help.
And about this febrile fits, people get really agitated with this, with these kind of fits. And how damaging are these fits? And should they be scared about it?
The fits are always very scaring, and whenever a child has fits, then the parents need to calm down the fever. If they are able to calm down the fever, then the fits will automatically go. If the fits are continued, then there are certain medications, injections, suppositories that should be given to minimize the fits.
So talking about fever, Dr. Saab, what is the ideal method to actually measure the temperature of the child? Should they be measured rectally or axillary or oral? What is the ideal? What would you suggest?
Well, the best way is to put a thermometer in the axilla for a couple of minutes.
Okay.
And first of all, shake that thermometer and then put in the axilla. After 2 minutes, take it out. And previously, when we were children, it was a thought that you need to increase 1 degree if you put it in the armpit. But now this practice is abolished. Okay. The temperature which is there in the armpit is actually the temperature of the child. We recommend mercury thermometers. Okay. The digital thermometers, they are not so reliable.
Okay. So you're saying that it should always be a mercury thermometer, clean, washed, used on that patient, particular patient. And if the patient is suffering from a lot of fever, the parents need to bring it down before they get them to you. Now, once the patient is with you and you are actually making a diagnosis, how do you tell whether the flu is viral or bacterial? What are the main differences between a viral presenting flu or a bacterial?
Well, the viral fever usually has more of the flu-like symptoms, and the fever is low grade, and the child is generally well. It doesn't seem to be toxic. Whereas the bacterial fevers, they present with a high grade fever, loss of oral intake, child is more toxic, and it has more chest symptoms as compared to the flu symptoms.
Okay. So when we talk about strep throat, like a lot of our patients get strep throat and they have a very bad cough and their tonsils are also enlarged. So how do they contract strep throat and how do you treat strep throat, the very common sore throat that we talk about?
Streptococcal throat infection is again something which needs to be addressed immediately, because if you miss a streptococcal throat infection, later on that child can land into post-streptococcal glomerulonephritis or post-streptococcal skin infection. In that case, it's important to take a throat swab to identify the streptococcal infection, and in that case, immediately antibiotic must be administered. Otherwise, later on that child can present with kidney problem.
Okay, and if it's a viral, how do you deal with it? You said there are more symptoms of like cough, coryza, watering eyes, watery nose with viral, right?
Yes.
That's what you said.
And
so how do we
in the
control
viral,
that?
in the viral, usually the other family members are also involved.
Okay.
In the bacterial, it is less likely that the other family members are involved.
Okay.
Secondly, if we are still unsure, we simply do a complete blood picture. Okay. And in the viral infection, there will be more lymphocytes, and in the bacterial infection, there will be more neutrophils.
Okay. So with more lymphocytes and more neutrophils, you are able to judge how to go about it and how to treat it. With viral infections, in how much time do they get, treated on their own? For example, they say they're self-limiting. So how many weeks should one expect that the child will be okay?
In simple viral infection, the child is usually fine after 3 to 4 days.
Okay.
Like on 5th day, the child starts improving. So what is important that parents should guess this thing, that is my child improving or not. Okay. If the fever is getting a gap, if the severity is getting reduced, then that means that he is on an improving trend.
Okay. And what about pneumonia? You said a lot of cases get complicated to pneumonia, especially during our winter season. What exactly is pneumonia? A condition of the lungs? How does it happen? What happens and how is it cured?
Well, pneumonia is a lethal cause of both morbidity and mortality, especially in Pakistan. We have a high mortality rate due to pneumonia. And what happens in pneumonia is that the child gets infection right down in the chest. It's not only the nose and the throat, it's actually the chest, the lungs are involved.
Okay.
And that advanced pneumonia will ultimately land the child into a decreased oxygen carrying capacity. His oxygen saturation becomes low, he becomes breathless, and ultimately he goes into respiratory failure and he may die also. So the parents should know that if the child is having a breathing difficulty and if there is chest indrawing in the child, or if he is using his muscles of accessory muscles of respiration, or if the nostrils are flaring, then these are the early signs which the parents should pick and they should promptly go to their doctor.
And how do you differentiate this with asthma? Because a lot of patients are chronic cases of like asthma and they also show these signs of wheezing and breathlessness and all of that.
Well, in asthma there is history of repeated seasonal allergies, and in asthma there is a typical wheeze. If I can make it for my listeners, it's like this.
Okay.
There is a typical whistling sound when you have asthma, and the child will more have a cough and a chest tightness rather than fever and breathlessness.
Okay, so that's the major difference. Now, a lot of children are suffering from asthma, especially in Pakistan. What could be the reason? Is it pollen? There are asthma, there are allergies, and then there is something called atopy, where they have skin allergies along with this asthmatic conditions. So when do they grow out of it? Which age do they grow out of it? And how do you deal with such children and their allergies and asthma?
Well, there are certain risk factors of asthma, like allergic rhinitis is one factor, DNS is another factor, repeated exposure to the environmental allergens like cold, like dust,
pollen.
like pollution, like pollen, like eating something like ice cream, like taking a cold drink, a changing weather. So all of these are triggering factors of asthma, and each parent should know what are the triggering factors of asthma, and the best cure is obviously the prevention.
Okay. So you said prevention is the best cure, but if a patient does get the asthma, acquires the asthmatic attack, then they have a lot of spacers, inhalers, nebulizers. How much do you prescribe them, and how would you guide our viewers as to use the proper, that spacer if there is an emergency, or if there is some kind of emergency with asthma and they begin to choke? What should the people in school be taught about it?
Yes,
Yeah.
this is something which we must taught to our parents and children. Like what I've seen, that mostly children they take oral medications, but then they are not encouraged for taking the inhalers.
Right.
Remember this thing, that taking an inhaler is an emergency and life-saving procedure in an acute attack of asthma. So if the child is small and is not able to take the inhaler, then there are spacers available for them which they should place along with the inhaler. And what is easy, the child has simply to breathe in and breathe out in that spacer, and the drug will go directly into the lungs. So inhalers are not only the rescue medications, but they are also for prevention of future attacks.
Okay. But a lot of children that I've seen on asthmatic drugs are on steroids as well, and then they have weight gain and complications of steroids. So how do you rate steroids and nebulization with salbutamol and all of this? Like what do you choose of the two?
Well, sometimes parents do ask, why are you giving steroids? These are usually they read on internet that steroids have a lot of adverse effects.
Exactly.
I do agree, but steroids are a strong anti-inflammatory. Steroids are made for a purpose, and if that purpose is not fulfilled at the right time in the right patient, the child can land into ICU, he can go onto ventilator, he can lose his life.
Okay.
So on one hand, we have some adverse effects, but on other hand, we can save the life of the child. So life is more important than certain adverse
for
effects.
acute management of an severe adverse condition, steroid is okay, but for long term, you would always give other sort of treatments like Ventolin and all of that.
Yes.
Would you be prescribing those, nebulizing?
Yes, I must clear one myth that if you're taking inhaler steroid, that doesn't have a systemic absorption,
Okay.
and it will only cause negligible effects as compared to oral steroids. These are the oral steroids which
That
have
cause more side
adverse effects, and especially if they are taken for a long time. Steroids taken for a short time doesn't have any adverse effect.
So during these conditions of smog, especially in cities like Lahore, that we have such a bad index of the air index these days, what do you suggest? Should they be wearing a mask? Should they use air purifiers? What should these children be doing?
Well, when COVID arrived, the best benefit which the people get, they were the asthmatics, because people started using masks and asthma attacks were very less in those days.
Okay.
If we use masks, especially in the winter, then the number of episodes of asthma will definitely reduce.
Okay, so you
we
do
recommend-
suggest
we recommend,
wearing a
yes.
mask and having some sort of air purification, indoor
Yes,
plants
also,
and all of that.
also. Humidifier, we also recommend humidifier in your room
yeah,
here.
for the dry cough and everything,
Because
right?
the air should not be cold and it should not be dry. We recommend warm and humid air in your bedroom.
Oh, that is really good. So we should have a humidifier, and if somebody doesn't have a humidifier, getting a utensil with some steam coming out is always a good option, right? Okay, a lot of people over here, they use different kind of menthols or Vicks on the chest and all of this, and then there's a trend to use cough syrups, and cough syrups are heavily sedative. So is a cough syrup a good option for cough? And there are two kinds of cough syrups. One are expectorants and the other are like, bronchodilators and all of that, or others are antihistamines as well. So what do you suggest? Which kind of cough syrups are okay? The cough suppressants like dextromethorphan or the other ones?
I don't recommend the adult cough syrups in pediatric population, especially in children less than 1 year.
Okay.
In children less than 1 year, cough is produced because of the bronchospasm.
Okay.
And if you're able to relieve that bronchospasm, if you're able to dilate the bronchioles, then you don't need too much cough suppressants. The only thing which you need in children, especially less than 1 year, is bronchodilator. It is available in syrup form, and you can do nebulization as well. If the parents are all alone at home and no medical aid is available, you can do a simple bronchodilator nebulization, and the child will be 50% relieved.
And what about steam? How much do you advise steam inhalation for children?
Steam is good as far as the problem is only in the nose and throat.
Okay, not
Because
the chest.
yes, it will open the blocked nose, it will give a soothing effect to the throat. But if the child has a bronchospasm and asthma, or if the child is having pneumonia, then steam will not help at all.
Okay. So there are a lot of mosquitoes also nowadays, and we have them biting us all over, and there was a lot of outbreak of dengue and malaria. How do you prevent these in children? What are the symptoms of dengue, especially in children, and malaria, and the treatment options? Precautions, complications, everything.
Well, children having dengue, they present with high fever and body aches. That's the first and foremost thing which we see.
Okay.
High fever with body aches. In malaria, again, there is high fever, but there will be more shivering in malaria.
Okay.
The dengue may have a rash, and dengue, we commonly see dengue in those areas which are already highly infected with dengue larva. There are
Right.
certain areas which are already affected with the larva. Dengue has a certain season, like this season, before the winter is the favorite season of dengue.
Dengue.
But malaria can come all around the year.
All right. And how does it present? Like you said, in malaria, you start shivering, and the fever goes down and then it goes up again, and like that. So what is the difference? They say that we have anti-malarial drugs, right? So they should start that. And for dengue, what is it? Like the platelet count is going really low. So it's only fluids, or are there other treatment options?
Well, in dengue, we don't need antibiotics. We don't need bunch of medications. We only give paracetamol, and we encourage to take a lot of fluids. If the patient is taking a lot of fluids, then it just needs monitoring of blood pressure, monitoring of hematocrit, and monitoring of platelets. Every patient needs a daily blood complete picture to see the platelets, a daily ultrasound to see any internal leakage, and daily blood CP also showing
So
hematocrit.
is this precaution very important that you should not be giving such a child anything like aspirin or ibuprofen, especially if they have dengue, because it can cause more bleeding? And also, what is the role of papaya leaf juice? It's very popular.
Well, we encourage fluids. So papaya juice is a fluid. So all juices actually help to maintain the blood pressure.
Okay.
What we love to see in dengue is that we don't want the child to become dehydrated and we don't want him to become overhydrated. Like we don't encourage so many drips also, because if you give too many drips, then that can cause increased capillary permeability and that can lead to swelling both inside and outside. So the oral fluids is always the best because they have slow absorption and they can't do any harm.
And they should use only paracetamol, not ibuprofen,
Yes,
right?
we recommend paracetamol and we discourage ibuprofen.
Yes.
But if they have given 1 or 2 times before the diagnosis is being made, that doesn't
And
harm
what about
the child.
chikungunya? How does it present? How is chikungunya different?
Well, chikungunya cases are only seen in Sindh part of Pakistan. We have not reported
But
cases
this program
here
is
in
being
Islamabad.
seen in
But
Sindh
yes,
as well. Yes.
but we will talk about it.
Yes.
Chikungunya mainly again has fever and it has a characteristic rash.
Okay.
So, and again, what I would recommend to the parents, if you suspect chikungunya, please do not self-medicate. Please do not make assumptions. Please do not say this has done this and this has done this.
So I will
Always go to the doctor, have a proper diagnosis, and inshallah everything will be fine.
What about chicken pox? The main thing that is always present in schools. One gets it, the whole the whole class starts getting it. How does chicken pox present, and how do we take care of it? How do we prevent the child from itching, from scarring, and when can we send them back to school?
Well, the first thing in chicken pox is just 1 or 2 pimples having a fluid in it.
Right.
The characteristic rash of
Blisters,
chicken pox,
right?
yes, it's a small fluid-filled blister, and initially there is maybe 1 or 2, and then they start growing, spreading. Along with it, there is fever. These are the 2 main signs of chicken pox. Usually, children get them from the school or the daycare or madrasa or mosque. The child only needs paracetamol or ibuprofen and something soothing
Calamine lotion.
agent to prevent the itching. That's it. There is no need of variety of medications.
And after 2 weeks, their child is safe to go back after the crust has completely fallen
Yes.
off. That is the stage when you can send them back.
When all the lesions have crusted,
Right.
that crusted means healed up, then the child can go into the school.
Yeah, and if they have itch, to resist that itch, they need to apply calamine lotion,
Yes.
right? What about measles? Because measles also presents with a rash and flu-like symptoms and all that. So how do you deal with measles, and what are the characteristic presentation as well as the treatment?
The first thing which the parents should pick it up in measles is that the child is having a very high temperature. Even it's not settling with paracetamol and ibuprofen. It's a continuous high fever. The second thing, child will have red eyes, a runny nose, a bad throat, and a cough. These are the early signs of measles. The rash comes maybe at 4th day or 5th day. It doesn't come early. So most of the measles, they are ignored initially and ultimately they land with complications. Everybody must remember that pneumonia is a lethal complication of measles, and otitis media and meningitis are other complications of measles. And measles, besides pneumonia, measles is another cause of morbidity and mortality in Pakistan.
And what is the treatment options for measles?
Well, we do give vitamin A in the measles. If there is secondary infection, we give antibiotics. Usually the children with measles, they don't eat or drink anything, so we give them fluids as well, and we make sure that the temperature is being controlled, and we make sure that the child is well hydrated. That's
How
it.
do we know that something has actually become meningitis, or when the child has gotten meningitis? Because we often see they start getting like a stiff neck, severe headache. How do you prevent meningitis, and then how do you should look out for it in case it complicates?
Well, if your child is getting meningitis, God forbid, because it's a serious condition, then usually there is high fever along with neck stiffness, body stiffness, he may be having an uprolling of eye, and he will refuse the feed, and he may have fits as well. So that shows that the infection has gone into the brain, in the spinal cord, in the meninges, and now it's a matter of life and death. You need to treat this infection seriously for a good period of 14 days, otherwise you may lose the child.
Okay. And what about mumps, the swollen parotid gland, how does that present, and is it self-limiting, is it viral, is it bacterial, and how do you treat it?
Well, the early thing which the parents can see in case of mumps is swelling, diffuse swelling right at the angle of the mouth, usually bilateral, but it can be unilateral. That swelling actually pinpoints that the child is developing mumps, and then on second or third day he may have fever and a reduced oral intake. Again, it's a viral infection. Please don't give antibiotics in mumps. Your child will be okay after 5 to 7 days.
And typhoid, another very common presentation, and a lot of problems related with typhoid, and then we will discuss diarrhea in detail as well, and gastroenteritis. But first, typhoid. The symptoms of typhoid, how do we identify it, how do we prevent it, and how do we treat it?
Well, the most important tip of preventing typhoid fever is to have clean water.
Right. Clean drinking water.
Clean drinking water is the best way to prevent typhoid, and the best thing is to do boiling of water. We have vaccination against typhoid and it's being done, but still we see a lot of typhoid, especially drug resistant typhoid.
Yeah.
That's because we don't have a clean drinking water.
Right.
So the first thing which the parents should pick it up in typhoid is a fever which is not touching the baseline. Fever and fever, all the time fever. The tongue becomes white, the child becomes lethargic, and he has a typical toxic look in typhoid.
Okay.
So that warrants the parents that child should be taken to the doctor and properly investigated. Secondly, why we miss typhoid? Because all the doctors should remember that the blood culture is the best test for typhoid. Typhoid DOT is not the best test,
Right.
it's being obsoleted now.
Yes.
But since blood culture is a bit expensive and not everybody can afford, especially in the peripheries, so that's why the doctors and the parents miss typhoid, and ultimately these children land with complications like they have perforation of their intestine and the other lethal complications.
So they need to complete the antibiotic course no matter what happens to get rid of the typhoid
Yes.
in detail.
If the diagnostic facility is not available, and if the doctor clinically thinks that it is typhoid, or even if he has suspicion of typhoid, please do complete the course of antibiotics. Please don't say that let's avoid the antibiotic.
Yeah, and for 5 days when the child feels better, don't leave it. You have
Yes.
to complete it. What about diarrhea? A very, very common presentation in children, gastroenteritis, food poisoning, they eat from here and there, unhygienic habits, not clean drinking water, and then they get a lot of loose motions and diarrhea. And in our part of the world, instead of giving them fluids, they stop feeding them everything, which causes them to dehydrate. So let's talk in detail about diarrhea, the symptoms of diarrhea, and the importance of ORS, especially if a child is vomiting or has excessive diarrhea and fluid loss.
Well, diarrhea is again one of the causes of mortality in children, and what I always advise to my students and junior doctors as well, even if you don't have any drug to give in medication, like if you are in a village where there is no medication, just give ORS. Your child will not harm himself. And if you don't have ORS, you can make a homemade ORS. You can take 4 glasses of water in a jug. You can add 2 spoons of sugar and a pinch of salt, and it will be a homemade ORS. And hydration is the only way to prevent deaths in diarrhea. And as far as the causative agents are concerned, again, the poor water, the poor sanitary conditions, the unhygienic food, and in the toddlers, putting things in the mouth, putting hands in the mouth, that's a common reason of diarrhea in children.
Exactly. So clean hygiene of the bottles and the food, and washing the food, covering the food, boiling and cooking is also equally important. You're right. What about tuberculosis? Another very common thing in our part of the world, whereas it's obsolete elsewhere. So tuberculosis, how does that present in a child? And now that we have treatment options available for tuberculosis, why don't people go and get that entire course done so that, you know, children can be free of tuberculosis?
Well, tuberculosis is again an important cause of morbidity and mortality, and what I have personally seen in children, that children don't present as like adults. There is silent tuberculosis going on into the children. If any child is not gaining weight, if any child is not gaining height, he has a low grade fever, please must rule out tuberculosis. It's very, very common here in Pakistan, and a lot of doctors miss diagnosis of tuberculosis, and I have seen even cases of pulmonary tuberculosis without fever and cough. That what is called asymptomatic tuberculosis, only leading to loss of appetite, only leading to poor weight, poor height. So tuberculosis is very oftenly missed, overlooked, and it should be properly investigated. And listen and remember, if the test reports are normal, that doesn't mean the child don't have tuberculosis. Tuberculosis in children can be there even the reports are normal. A strong family history and a strong clinical history and a PPS scoring is the best way to diagnose tuberculosis.
And then they have to get that, and so it's not just a sputum culture.
No.
They have to get a PPS score, and then they are diagnosed
It's a
with
scoring.
it, and then they have to be given that entire course. What about jaundice in children? How common is jaundice or hepatitis A and E or B or C, for example, in children, and how do we detect that they have this active jaundice, because the other two are hidden, and then how do we treat that?
Well, the first thing which the parents should pick it up in jaundice is a yellowing of urine.
Okay.
If your child is passing urine which is more yellow than the routine, then parents should think that the child may have jaundice. The other symptoms are abdominal pain, vomiting or nausea, and yellowness of eyes. So and a loss of appetite. Even loss of appetite may be the first symptom of jaundice before the eyes get yellow or the urine gets yellow. The loss of appetite, and usually in children hepatitis A and E is more common, whereas in adults hepatitis B and C is more common.
And what about giving them like sunlight exposure and all that? Is that important, or just the, you know, just the medication?
Sunlight as a treatment modality is only for the neonates, for the newborns. Hepatitis A and hepatitis E in older children does not have any effect from sunlight. You need plenty of fluids, you need some liver tonics, you need to avoid the oily things, and you need to take a lot of fresh juices.
That's very nice. Thank you so much for giving us an entire in-depth analysis about each and every disease. What about polio, the most talked about problem in our part of the world, and everybody is against these polio vaccines. They hide their children when people are coming to vaccinate them. How important is it to get vaccinated? Because we're the only country now left probably in the world that has polio and is not doing anything about it. We keep having all these campaigns, but they don't seem to be as useful. So how does polio present? How can it be prevented? And why is there such a myth surrounding these vaccines in our part of the world especially?
Well, whenever I go to any international conference and I talk to international doctors, I feel embarrassment that we still have polio in our country. The biggest myth is that polio vaccine may cause sterility. I want to tell all the audience, we have been drinking polio drops since our childhood, me, you, everybody here.
Exactly.
We have, and we all happily married and we all have children.
Yes.
And the population of Pakistan is increasing day by day. Every year we are increasing. And if we are taking these polio drops for so many decades, and still we are becoming the world's most populous country,
right.
How is it possible? It's only a myth.
Right.
So every parent should vaccinate against polio, and it's not only the responsibility of the government and the polio workers, it's the responsibility of teachers, doctors, engineers, the ulama ikram, everybody, every every person who is educated should talk about and should encourage and advocate polio vaccine. That's the only way we can eradicate polio.
Okay, so polio is contracted via contaminated water as well, and we need clean sanitation and clean drinking practices. But once somebody contracts polio, is there a way to treat it or no? They have to be just vaccinated beforehand.
Well, it's a permanent disability. It is a motor affecting part. The motor system is involved. So if a child has polio, he will be disabled permanently. So what I recommend that vaccinate. And you can prevent this disease only by vaccination. Once your child gets polio, then it is not curable.
That is so scary, and it's so sad that people don't realize the seriousness of this situation, that they can actually do nothing about it. When we talk about nutrition, let's talk about healthy nutrition for the child. So how do you, assess that a child is growing according to the development milestones? What is the ideal, growth rate, height rate, weight and everything? And what is the ideal nutrition to be given to a child that improves the immunity of the child, the weight of the child, the mind of the child, the physical ability, to avoid both malnutrition as well as obesity?
Well, in the West, they have normal physical checkups. They have a concept of a well baby clinic in which the parents take their child at an interval of 3 months just to see that is everything okay,
normally,
is he growing well,
Yeah.
is he maintaining his eye contact, is he holding his neck properly, is he sitting properly, standing properly. The different milestones at different ages are properly assessed, and if the child is having a delayed milestones, then they find out the cause why he is delayed. Unfortunately, here in Pakistan, we do not have a concept of well baby checkups. We only land to the doctor when
something is wrong.
the water goes above our head and the child is in serious emergency. So it is very important for both parents and doctors to assess this thing, that whether the child has an appropriate weight according to the age, and is he having an appropriate height according to the age and appropriate head size, and the rest of the social and behavioral milestones. So we need to check it at different intervals.
And what about the ideal nutrition? For example, what is a diet that is rich in vitamin D and in other nutrients? What should you be giving to a child? Because most of the children out here, they go to these different shops here and there and just they buy candy or those things in the packet, processed food, and they don't focus on good nutrition in terms of fruits, vegetables, meat, eggs. They just avoid that. So could you stress the importance of organic food, home cooked food?
Yes, I always encourage the parents to have a proper diet, balanced diet. So parents ask me, what is a balanced diet? I tell them the balanced diet is the one diet which has different ingredients, that it should have both carbohydrates, proteins, fats. And if you can't do much about it, just do simple thing, mix two food items. If you have a vegetable, mix some meat in it.
Exactly.
If you have rice, mix some dal in it. So mixed items in food will give you a more balance, and eat natural diets.
Right.
Don't go for artificial and packet things. So every packet, every artificial things have artificial sweeteners, they have a lot of sugars, and they are far from natural diet. So natural diet is the one which is not processed, which is not being stored in the packets in the shops.
No colors, dyes,
Yes.
emulsifier, preservative is not there. What about autism, Dr. Saab? That is another very common presenting complaint nowadays in children. So many children are on the spectrum. They start having behavioral problems. They start having learning problems. How do you get a lot of such patients, and then what do you usually guide them to?
Yes, I do see a lot of autism patients these days. And besides genetic causes, although there is a genetic predisposition of autism and there are certain unknown factors, what in addition to that, I have personally witnessed that all those pregnant ladies who have used a lot of mobile phone during their early pregnancy,
Oh my
during
God,
their
you are
early
scaring me.
pregnancy, their children are developing autism later in the life. So what our ladies do these days,
So right.
at night they used to see the Facebook and YouTube, and then suddenly fell asleep, and that phone often remains close to their pregnant tummy
my
or
God.
close to their body the whole night for 9 months. So imagine what it can harm.
This is so scary, so dangerous.
Yes.
I think, thank you so much for bringing this point out here. I hope more and more people listen to it and understand that a woman has to be responsible. Even the man has to be responsible if he's sleeping next to her. The phone should not be in the bedroom.
Yes.
Pregnancy or not,
Yes.
it should
Radiation.
not be. It's all radiation. And what about this, excessive use of microwaves or TV or any sort of screen by the children itself? You discourage the use by child itself, right?
Yes, we don't recommend microwave ovens. In Japan, they have taken over all the microwave ovens, and we do not recommend here. So if you need to warm anything, make it on the normal heat, normal waves. The second thing, why our children are using a lot of screen, a lot of mobile phone? Because the parents are looking at a lot of screen. Because the parents use mobile phones. Parents see YouTube and Facebook and
front of
Netflix.
them.
So the child also has a heart. He also wants to see
he wants
those
to
things.
imitate. He
So
wants to imitate.
if you want that your child should not see the screen, you should avoid the screen. You should use only phone for the
work
call
purposes.
purpose.
Yeah. Yes, you're so right about that, and in fact, we have to. What about, let's talk about hygiene, because that is also very much missing in our part of the world. We have so many children come with fungal infections, with impetigo, with
Scabies.
lice problems, with itching due to scabies, the bad hygiene of the house, and they keep getting repeated such fungal infections. So the important, and nappy rash, very, very spoilt nappy rash as well. So please advise the parents on hygiene as well. The child's hygiene, how important it is to bathe, shower, change them, change the surroundings, and how to go about it.
Well, I must tell parents two simple things. One is water and the other is air. Believe me, water and air are the two protectors of your child. If you are cleaning your child with water, and if you have an ample amount of air, ventilation in the room, you will prevent a lot of skin problems. But on the contrary, we see that especially in winters, the mothers, they do not wash their child, especially the nappy area, so they get a lot of fungal infections, nappy rash, and they have closed all the doors and windows,
no sunlight, no ventilation,
that cold air may come. Please do remember that it's the air which we are breathing. We all need fresh air to breathe, and similarly, if our lungs need fresh air, then the rest of the body also needs fresh air to remain active and alert.
Yes. So hygiene is definitely a very important part, and we spoke about nutrition as well. Now about vaccinations, the EPI schedule. If you could kindly just give a quick overview as to when along at birth and at 1 month, 6 months, 9 months, when should we get which vaccine?
Well, every child born anywhere in Pakistan, especially in the world, these vaccinations, they are recommended worldwide. Every child should get a BCG, which is against the polio at birth, hepatitis B at birth, and then at 6 weeks, then at 10 weeks, then at 14 weeks, then at 9 months, then at 12 months, then at 15 months, and then at 18 months. This is the basic vaccination which each and every child should get, and I must tell all the listeners that this is being given free in Pakistan at the government level, free of cost, and please do avail this facility, and please don't involve in myths against the vaccination. Even there are certain educated people who have certain myths against the vaccination. So vaccination is something to help you. You don't listen to me. You just Google and find out how many deaths tuberculosis was once causing decades, centuries ago. How many deaths did this whooping cough cause centuries ago? Smallpox. How many deaths? Measles, pneumonia. All these diseases which are being now, we are being vaccinated. Few centuries ago, when there were no vaccination, the whole of the populations, they were being eradicated by these diseases, deadly diseases, and now, alhamdulillah, we are living in a peaceful environment because of these vaccinations.
Alhamdulillah. And we all want our children to be healthy. So could you also tell our audience that it's very important to space out the children, not to have one child after another so, with such little interval. So an ideal gap of at least 2 to 3 years between each child is very important for the child's nutrition, and how important breastfeeding is for the child, so that one child can at least avail the breastfeed of a woman before she gets pregnant again, and everything.
Well, I would recommend all the parents that you should have at least a 2 years space between the child, and you should have all the barrier methods to prevent the pregnancy. But if you are failed and you get the pregnancy and you don't want it, please do not abort. There is no permission in the religion as well as in the medical science to abort your child just because you don't want it.
Right.
You need to take all the preventive measures before conception, and if you have conceived, then just carry on. Secondly, if a pregnant lady has conceived and she is breastfeeding the already born child, please continue. Just take a plenty of water, green tea, fluids, milk. You need to muster up your diet, then no harm, it will cause no harm. Usually there are myths that if a pregnant lady is breastfeeding, then the milk becomes poisonous and something like this.
So you should continue breastfeeding.
Yes, as far as she can.
Okay. Thank you so much, Dr. Saab, for talking to us in such detail about child health, and I'm sure our audience also benefit today, and they know now that how it is important that even before a child is born, the mother and the parents have to act responsibly and act accordingly so that the child is born without any abnormality, and from its birth till its till you actually raise a child to his adolescence and then puberty, it's very important to focus on nutrition, vaccination, habits and everything else. So we had with us Dr. Junaid Jahangir. Thank you very much, and we shall meet you next week inshallah. Do join us. Thank you and Allah Hafiz.